asked practices, what are you going to do? What's going to happen when sequestration hits on April 1st if they cut this drug side? And it was really scary. 331 practices responded. They basically accounted for over 2,000 oncologists. 72% said, we're going to have to do something. We may not be able to see new Medicare patients. We may not be able to see any Medicare patients without secondary insurance, or we may have to send everywhere elsewhere for treatment. Obviously, any practice, a good clinic, is not going to just drop patients, but you then caught in a rock and a hard place is, if I don't send them somewhere else, if this is a problem, then how do we keep viable? And if they're not viable and you can't pay your bills, you don't have a cancer clinic. Well, number one, we've been calling attention to this. And our message is, Congress, fight cancer, not cancer care. We've been advocating on Capitol Hill. And you know what we've been saying? And a lot of people question this, but we've been questioning the legality. Can they cut the pure drug side? We've said, wait a minute. Unlike sequestration cutting a budget or cutting a process for defining a fee, it clearly says this is what providers will be paid. The average selling price that the manufacturer sends to CMS that administers Medicare, and that will be it. So we've been even working with the attorneys because this is too important. We're looking at what could be an implosion in terms of cancer care. Here's the kicker. In pure financial terms, we did this calculation because there's great data out there. So admittedly, it's an extrapolation, but it's a pretty good one. It's going to cost Medicare $2 billion. Now, we suspect our calculation is, in rough round terms, they'll save $500 million with the cut. So what, you do the math, it's going to cost them a net of $1.5 billion a year. I mean, this is the way the government works, and we call this up on the Hill the unintended consequences of public policy. I get off the Hill and I say, this is screwy.